I want to know what counts as a specialist, because to me, the doctor is the doctor. And sometimes they have different job titles, but I kind of go into a room, there's a white coat, they chat to me, whatever. So, what is the difference between a specialist and a PCP, for example?
So typically, right, when you're going to medical school, right, you're focusing, you're specializing in one of many areas, and the some of the most incredible doctors are the frontline, and oftentimes they are generalists in doing family medicine. They're treating a whole host of things, and you go to them as really that first line of defense, saying what's going on. But listen, they're not the ones that are going to give you, knee surgery or diagnose a complex issue with your stomach or heart. They're not the ones that are going to go and do your imaging for you. They're going to refer out, and so those specialists they're all doctors, they're all providers, the way we would refer to them. But we really only focus on the providers and the businesses really that are getting sent patients.
All right. So I go to a PCP. They say, Alex, you need to go talk to a nephrologist. And then what happens right at that moment, and how does it break?
So it's like you kind of have to think about it as like a funnel, right? If you clicked on an Instagram ad for the incredible, shirt that you have on there, right? That funnel is super, super tight. All your data is going to neatly get passed on over to the store that's trying to sell you that shirt. And, you're going to enter some information. And man, if you don't buy that shirt right then and there, they are going to hound you, and they're going to find you on every inch of the internet until you buy, because what they really care about is capturing you as a lead. Right. And so most people think about patients as patients, and not enough actually as a lead that really needs to go be serviced and worked to go and actually get their attention. And the problem is when that provider sends you, Alex, as a patient, they don't just send, a nice clean data blob of data. Oftentimes they're sending all your chart history, a bunch of documentation, labs, studies, their notes, their determination of what they think is going on. And so you end up sitting on a backlog, and that backlog is heinous. And what we help people do is get through that backlog while engaging the patient every step of the way, so they know what they're going to pay, if they're going to be denied for medical necessity reasons, and really what the roadblocks are to actually getting in. And it turns out, basic human psychology, if you're able to contact you, Alex, within 5 minutes saying, look, this is what it's going to cost you. We're missing this one piece of documentation. If you can go back or go get imaging done for this one thing, you're going to be able to get seen and serviced. It's just tremendous, like the impact that it has on actually converting patients into real visits.
So we talk a lot about in like the e-commerce world about reducing friction in the checkout flow. Like every time you can remove a step, your overall conversion rate improves by X percentage points. It sounds like the current referral system is just like a 50% fail funnel to getting people from you need this to them actually getting it. So using Tennr's system as it exists today, how much better is the successful rate from referral to care?
Well, you're going to hate this answer, but the reality is it totally varies by specialty, right? 50% for gastro, where somebody's going to stick something, where the sun don't shine, is actually an incredible conversion rate, right? So you're trying to get more towards.
Is that because people don't want to actually go get those appointments?
Yeah, there's certain pieces of care that people do not want to go and get. There's other care, right, where you are going to get that care. It's just a matter of whether or not you go to the first place that you were actually sent. And so in that place, you as a patient, you're going to get service one way or another. It's just a matter of if you have to go and hound down the door yourself. And so you as a patient may convert personally at like an 80% rate, but the provider that received you, for us, we're dealing with a lot of folks in the 50 to 70% range trying to get into the, 70 to 90% numbers. I mean, it's really astounding actually the sort of impact and that you can do on a per provider basis.
Okay. So how many people in, let's just say the United States, does this apply to? Because, as a person not in the medical field, my exposure to the doctors is whenever something breaks in my body, I go talk to them, but past that, I don't think about it much. So how many people do you think are impacted each year by this broken linkage between primary doctors and specialists?
Yeah, so it's in the tens of millions from an individual's basis in the United States. But what's interesting about that is that, unfortunately, a lot of the folks, it's not like it'll happen to one person one time. For a lot of these people, they're seeing different specialists every month. And even for a single sort of patient journey, where this gets really quite a bummer, to be honest, is oftentimes you'll have sort of six links in the chain to the point that you're actually getting treated. And at every single point, you're dealing with this insane friction and the same sort of, paperwork obstacle. It can be months for a whole patient journey, but we see oftentimes patients that are not getting contacted by a single provider on the order of 5 days to 2 to 3 weeks.